Lu Park, and I'm 77. I learned about Dr. Leeman about 3 years ago. I have dealt with migraines ever since a severe wreck in 1975. Originally about once a month, and then over the years it began to be every 2 weeks, or 3 weeks, and then every 2 weeks, and then every week, and then more than one a week, and lasting more than a day. So I was really encouraged that there was something that I might be able to use to help change these, because it absolutely interfered in my life. If we were about to go to a Thanksgiving gathering and I began to get a migraine with the nausea and the sensitivity to light, I would end up in bed, not at a Thanksgiving gathering. So I was very relieved to come and talk to him and begin to get the injections, and they work to a great degree. For me individually, it's not 100%. I still may get 3 or so in that 3 months, about 1 a month, sometimes 2 a month, but not the 12 to 20 a month that I was having before I started the injections. So I've been very grateful that he's here, and he and his staff have worked to help me reach this much happier state of being.
Okay.
Hey Austin, Dr. Leeman here again, and we have another patient success story. I have with me my lovely patient, Ms. Park, who's been a patient here for about, 3 years in the practice?
So.
Yeah, and so she basically was struggling with severity of migraine headaches, which were quite disabling and quite disruptive to her activities of daily living, and to the point where she almost had to just lay down and go to bed. Is that not true?
Times I had to, absolutely had to, and it might be a day or two.
Yeah. And so what we were able to determine that actually Botox works really well to help basically reduce not only the number of headaches you're getting, but the severity of these headaches. And this sort of helped kind of change your life. And can you talk to a little bit about that process and how it was coming into the practice as a headache patient and not really knowing what we could do, and getting educated and being advised of this option, how that was a relief to you?
It was a relief, and one thing we were talking about today is that they take the time to work with the patient to determine what quantity is needed, which points are needed specifically for that patient, because we're not all the same, we're all different.
That's a good point.
And that's very important that be the case. So I found that here as well, and not having to expect or anticipate, okay, what happens if we're doing this activity and then I start to feel bad, and knowing that the likelihood is so much less, just knowing that is reassuring as well.
Absolutely. So this is something that, as Austin practice, we see a lot of migraine sufferers and feel that Botox is a great treatment for them, and it can be, like Mrs. Park's situation, life-changing for you, and your quality of life has improved tremendously. We are sad that you're leaving, though. You're relocating to a new chapter in your life. So we're gonna miss seeing your smiling face every 3 months. But anyway, we do wish you all the best and safe travels. And thank you for trusting yourself and your care to my practice. And we've enjoyed having you.
Thank you. I've enjoyed the connection with everyone here.
All right, we'll see you, Austin. Be safe.